Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Dr. Uzma Saeed. She's an infectious disease physician. Uzma, welcome to the show.
Thank you so much. Thank you for having me.
So, she wrote this wonderful article in Kevin MD during the pandemic, Faith Keeps Us Together. And we're going to get into this article later on. But first off, tell me your story and your journey to where you are today.
Absolutely. Everyone's path in medicine is quite unique and quite different. I was fortunate enough to know at a young age that, I had this passion towards medicine, and I sort of followed that throughout my schooling. Ended up in medical school and pursued that through, internship, residency, where you find your path. And it was early on in my residency that I was fortunate enough to do an ID elective and really fell in love, with the field. For the longest time, there was this question of what I was going to pursue. But having that very first day on that rotation just made it clear as day. Everything that I loved about medicine just sort of came together. The detective work, the wide differential and the cerebral aspect of the field was really appealing to me. The history taking and really coming together to formulating the diagnosis and then coming up with therapeutics that you can essentially cure people and, nurse them back to health and, see from start to end, their recovery. This whole process was really rewarding. We were doing medicine to help people, and it was really nice to see that you could really provide care for people that would help them get back to their baseline and better health. There was always something new. You never knew what was coming through those doors. You never knew what the next consult was. It could be something very basic, very, bread and butter to, something very complicated. You had the returning travel with, a fever and, the differential was just enormous. Kept your mind going all the time. And, that was what was very exciting for me. So I knew that every day that I would give to this career and this, a passion of mine would bring tremendous reward and would keep me engaged. For ID physicians, the pandemic essentially that we're in, this is something, a novel virus, these outbreaks that we have happened, we've dealt with SARS before, we've dealt with MERS, we've dealt with, swine flu, we've dealt with Zika, all these things, so this is, really exciting for us. It's a worldwide pandemic. We see the tremendous amount of lives that are being lost. It's been really exciting and really difficult and challenging at the same time. We've been in tune to this from the very beginning, following this very early on from December. Just sort of having all of us had some form of anxiety and a lot of butterflies in our stomach because we knew it was coming. We were following this globally and it was just a matter of time. So, as we were waiting for the arrival of, our pandemic, we just were trying to ring the alarms and get our hospitals ready and really do whatever we possibly could to really be as best prepared as possible. But we knew that no matter how much we did, the scale that we're at, we sort of had this fear that, it was going to be to this extent and to this level. And, we're all learning so much throughout this whole process. So it's really been, really challenging and really rewarding in different ways and sort of come together as a community. So I thank you for giving us the platform to really, connect with each other.
Well, thank you so much for writing, and thank you for doing what you do. So we are filming this a few days after Memorial Day, and states are starting to reopen. So if you could give a prediction of what the next 3 months would be, what do you think would happen?
So that's a great question. It's really interesting because, our country is very large and it's very diverse, from region to region. And being in New York, being at the epicenter, we've had the brunt of it. We've gone through the worst, we've been in the trenches and we've seen the worst of it and we are coming back from it, so we have dealt with the worst case scenario essentially, but there's so many parts in the country that have very little disease burden. So, it's really difficult to compare every single region. It's like comparing apples to oranges. So we have to do and predict models that are going to apply to each specific region, which is why we always say that, to look at the public health authorities and, the local Department of Health and the disease burden in each specific region. Majority of the country is, has reopened to some form or the other. And what that means is that, people, we have been really reiterating that we have to do our due diligence. The virus, unfortunately, unfortunately has not gone away. The weather has gotten better. People are sort of really tired of being cooped up, and everybody just wants some form of normalcy, which is completely reasonable and humanistic. We all, we crave that human encounter, and we hate isolation. That's just not human nature. But we have to tread very carefully because, we know that this virus is still out there. And so we have to use our best practices to really prevent further transmission of the virus and, deal with our new norm and acclimate to that carefully. And that really entails, the masking, continuing with hand hygiene and limiting large crowds. That's really the only way that we're going to get through this. There's always going to be some form of inherent risk, no matter what. You can't really be isolated and live in isolation for, indefinite amount of time, because we're talking about, a vaccine is going to be the only preventative and curative thing at this point. And that's, a very long timeline, as you know. So we have to get back to some form of normalcy, but it's going to be very, very modified. And we have to do that knowing that there's always a little bit of inherent risk. And, how can we operate, in the best case scenario to make sure that the risk is, as minimal as possible, and that we're constantly evaluating, what kinds of situations are we putting ourselves in, the risk to us, the risk to our families, the risk to public health, other people, every person that you have an encounter with, there's, sort of a domino effect. So I think people need to keep that in their mind, and going forward, as things like you said, that it was just Memorial Day, and, there were lots of large gatherings, places, and, what people have to sort of keep in the back of their mind is that, there is a lag. This is something that we have been saying from the beginning, that the actions today are not going to have consequences for several weeks. So, majority of the states, a lot of the states that are reopening don't necessarily meet the criteria for reopening. We know that you have to have documented, decline of 2 weeks at least in the virus, and a lot of places don't have that. So I think what people really need to keep in mind is that, this is a lethal virus that is affecting all ages. It's not discriminating. We are seeing the pediatric population also being affected by, an inflammatory condition as well. So we have to keep that in mind, and we have to know that there are significant consequences to people's actions. So that being said, get back to some form of normalcy, but very cautiously, and take the right precautions, because we are going to keep climbing. Our numbers are skyrocketing, and they're going to continue to go that way. And we have to, each of us has a responsibility in this to prevent further deaths.
Sure. So let's just switch gears and talk about the article that you wrote for Kevin MD. During the pandemic, faith keeps us together. So can you share the story behind that article, and why did you write it?
Yeah, absolutely. So being on the front lines, so many of us had to go through this really difficult experience, and something that we never thought that we would have to encounter, in our lives, and it was so challenging. The volume of people that were coming in that were acutely ill, requiring, mechanical ventilation, requiring ICU care, the number of people that were dying, it was very traumatic. And, there was just, certain things that could help keep us grounded. For me personally, my faith was one of them, because there was just not enough time in the day to really seek, that shoulder to, cry on, or someone to speak to try to decompress, because all of your hours were spent, taking care of patients. And then whatever little time you had left was, to sleep, eat, and, spend a little bit of time with family. And, most of us, had additional anxiety with family members, worrying about keeping them safe and how to do that appropriately. So for me, practicing my faith was really something that helped ground me and get me through this difficult time. Very, 2 to 3 minute prayer, that I do 5 times a day, was very spiritual and very grounding for me, where it gave me that release of calmness and sort of let me focus a little bit, unwind and detach, and then sort of then get back to the task at hand. And so, that was very, very helpful for me. And I found that a lot of my colleagues were going through similar things as well. As a community, faith is something that, I'm part of the Interfaith Council, in our local area, and we have a lot of different clergy and different community members that were struggling with this time about how do we continue to provide the support to the community where, we weren't able to congregate together, because, for faith-based practices, everything is about congregation and coming together
Yeah.
in large numbers. And because of the virus, unfortunately, we were not able to do that. So everybody was, adjusting to their new norm by doing things, remotely, virtually, and sort of, figuring out what the new norm was. But we were still able to connect and be together with all the holidays coming together, very close together, the Christian, Jewish, and Muslim holidays. Ramadan was starting at the same time. We all had something similar to experience. And it was, we all knew that we're in it together for humanity's sake. And although it was not ideal, was not what we are used to, we still found different ways to connect and to stay grounded and uplift each other and get everyone through this difficult times, whether they were in healthcare in the front lines or in the community helping people cope, their family members, their loved ones, or other healthcare workers. But it was a beautiful thing to see everyone sort of come together and for the sake of humanity.
So for physicians who are interested in incorporating more faith or spirituality, whether they're in their practice or their professional life, what advice do you have for them?
Yeah, so I think that's a really important question that I've mentioned personally. For me, spirituality has really helped me through this process in this difficult time. But a lot of people can experience the same kind of spirituality, whether you're in difficult times or in good times. But whatever works for a person, whether it be a simple prayer for a few minutes a day, taking some time out to just reflect on yourself and really not have any external factors, so that you can really take a few minutes for yourself. Whatever way that you feel connected, whether it's religion or some form of spirituality, it could be, writing poetry, it could be anything that gives you that release. I think it's really important to have some form of that, so that you can continue to go on. Whether we're in a pandemic, which we are tested to our max in most difficult scenarios, or a day-to-day, healthcare, for physicians especially, we have very high stressful environment. And finding these ways to balance and to have a little bit of time for self-reflection is really necessary for our mental well-being, our mental health, and to continue so that we can provide really good care for our patients. Oftentimes we don't, spend the time on ourselves, and self-care is really not important. But this, having a way of spirituality, a way of connecting, whether it be religion or some form of spirituality, is really, really essential for physician well-being as well. So I think this is a good time to start those practices, and you can continue to do that whether you're in a pandemic or not.
And my last question is, what's the take-home message that you have for the Kevin MD audience?
I think the take-home message is that, it's been such a wonderful community to be part of. And I think we've done so much for each other as physicians. The community outside of the healthcare industry has done tremendous to support all of us as well. And I want to thank you for all of that, whether it be sheltering in place, raising funds for PPE, providing support and recognizing, the first line workers has been tremendous. And for healthcare workers, it's been amazing to see the camaraderie, to see the support in these most difficult times. We've had, social media has created a platform for us to really be there for each other, whether, the distance is minor or major between us physically. We have an avenue to discuss things. We have an avenue for support. We have an avenue for education.
Well, thank you so much for doing what you do, and thank you so much for sharing your story. We have Dr. Uzma Syed, who's an infectious disease physician, and she wrote this wonderful article on Kevin MD during the pandemic, Faith Keeps Us Together. Thank you so much for being on the show.
Thank you so much, Kevin.